the other one. Okay. Well, good morning, everyone. This morning, I would like to take a short journey across the Atlantic Ocean to the San Blas Islands. This is a group of small islands just off the coast of Panama. And what is interesting here is that the people who live there have low blood pressure and low rates of cardiovascular disease. But why is this? Well, yeah. I can imagine living on a tropical island with sandy white beaches and clear blue sea isn't too bad for your blood pressure. But there could be something else. You see, the people who live on these islands, they eat a lot of cocoa, a lot of raw cocoa, more than anywhere else in the world. And studies have now shown us that people who consume more cocoa have lower risk of cardiovascular disease. Now, so this is a great example of a food which can lower your risk of cardiovascular disease. This isn't the only example, though. For a second example, I'd like to take you a little bit closer to home. For the second example, I've taken the British people. I'm not trying to say they've got a remarkably healthy diet, because I think we'll be kidding ourselves if we believe that. But one thing they do well, the British people drink a lot of tea. And just like with cocoa, people who drink a lot of tea have a lower risk of cardiovascular disease. So why is this interesting? Well, especially in the Netherlands, cardiovascular disease is one of the leading causes of death. More than 1 in 4 people die from cardiovascular disease. So if we can identify foods which lower the risk of cardiovascular disease and understand how they work, maybe we can help to lower the risk of cardiovascular disease. So looking at cocoa and tea, is there a link between the two? Apart from obviously being the ultimate comfort food, there is an actual link. Both cocoa and tea are rich in flavonoids. Flavonoids are complex structures, which you might be able to see here at the top, which are only found in plants and plant-based foods. Lots of different flavonoids exist, but in cocoa there's one which really stands out, and that's apicatechin. And interestingly, apicatechin is also present in tea. But tea also contains quercetin, which is another flavonoid. So is it possible that these two flavonoids, apicatechin and quercetin, are responsible for the cardioprotective effects of cocoa and tea? Well, strangely, we don't know. Or maybe I'll be better off saying we didn't know. Because this is something I've been researching for the last couple of years. And a couple of years ago, we conducted an intervention trial here at the university, where we selected 37 men and women from the area of Wageningen. We then asked them to consume pure apicatechin and pure quercetin for 4 weeks. And after 4 weeks, we measured a whole host of parameters related to cardiovascular health. So we measured their blood pressure, their endothelial function, their insulin resistance, and also inflammation, amongst others. And what did we find? Well, for apicatechin, interestingly, we found that apicatechin improved insulin resistance, which is an important risk factor for cardiovascular disease. We also found that apicatechin improved endothelial function and blood pressure, but the changes in blood pressure and endothelial function weren't significant. For quercetin, the story was a little bit less promising. For quercetin, we didn't see any changes in endothelial function or blood pressure or insulin resistance, but quercetin did improve inflammation. So coming back to the question of whether apicatechin and quercetin are responsible for the cardioprotective effects of cocoa and tea, I think for apicatechin we can say yes, it does contribute. For quercetin, I don't think we can go much further than to say maybe. The effects of quercetin were so mild, especially when compared to the effects of tea. So my take-home message is that apicatechin does improve cardiovascular health, but the effects of apicatechin aren't as strong as cocoa or tea. So there is still more in cocoa and tea. Thank you.